Okay, so when you come to my office or any other buddy's office for your problems with pain and discomfort, you want something to happen. You have a goal in mind about what you want. Let's talk about that goal for just a minute here because it's really important. If you don't know where you're going, it's kind of going to be hard to get there. So let's talk about what the goal is in your treatment. What do you want out of this treatment? Because what that'll do is that'll allow us to make a framework, a path to get you to your goal, okay? So where are we going with all this? I'll tell you how I think about this whole business. And it's like this. Here is your life. All right, we're going to make this big Venn diagram circle your life. You've got your family here. You want to interact with your family. You got your work. You've got your play. Maybe you like to golf. Maybe you like to play with your kids. Maybe you like to run. All this wonderful stuff you want to do with your life, okay? However, in the middle of your life right now, you have this pain, which is restricting you. You can't really work as much as you like because it hurts. You can't really play as much as you like because you hurt for the next 2 days. You swing a golf club, you know your back's going to be miserable. Interacts with your family time. You can't really throw the football around with your kids. So what's happening is actually your life is getting pulled in. You're not able to do everything you want to do in your life because of all this pain. That life is sort of fading into the background, and the only thing that's really in the foreground right now is your pain. You're able to do a little bit, this tiny little subset of what your life used to be, okay? You can walk from the bed to the chair, from the chair to the bed. You work a couple hours and then it hurts. You go up to throw the football for 2 minutes. Oh my God, I got to sit down. Okay, this is not how you want to be. So you're pulling your life in, you're restricting your life to fit your pain. That's not what we want. What we would like to have happen, the goal of this whole exercise, is for that pain to fade into the background. It'll be there, but it'll be in the background. And you're then able, with that pain in the background, to start living your life more, to be able to interact with your family, to play, to sleep, to work comfortably. If you want to go running, go running. You want to throw the football around with your kids, no problem. You want to swing the club with your friends, that's good. Okay, so the pain is going to be there. It's just that it's not going to restrict you. You're going to be able to expand your life back to living the life you want to live, even though the pain is still there. That's the goal of the exercise. That's why you're here. That's what we should be trying to do. So we've talked about what is the goal of the exercise, but we should spend a couple minutes talking about what the goal isn't. Because if you start heading off in the wrong direction, you're never going to get to the right direction. So let's talk about a couple of things we're not trying to do, all right? The first thing we're not trying to do is to have you be pain-free. I've got news for you. Nobody in life is pain-free. You will never have zero pain. What you will have is pain that's controllable, pain that doesn't interfere with your life, pain that you can live with, okay? But pain-free, forget it. Anybody tells you they're going to make you pain-free, walk out the door. What else aren't we going to do? We're not going to have you understand why you hurt. Nobody knows why you hurt. It's a very complicated system. There are a lot of parts. It's a so-called complex system. Google it. It's like the weather. It's like airflow over a wing. It's very difficult to model. So nobody can tell you for sure why you're hurting. What we can do is make you hurt less and make the hurting not interfere with your life. Those are reasonable goals. But telling you why you have pain, forget it. The other thing we're not going to do is fix the arthritis, whatever you want to call it, on your MR scans, okay? Make that bump on my MR go away. We're not going to do that. Why? Because we don't have to. If you had, for the most part, if people walk into my office with an MR scan with pain, and if they walked into my office with the same MR scan without pain, I would ignore the MR scan. So we're not going to focus on your MR scan. We're going to focus on you. If we can make you feel better, we can then politely ignore your MR scan. So these are the things that we're not trying to do. We're not trying to make you pain-free. We're not trying to explain why you have pain. We're not trying to make your MR scan look better. We're trying to make you feel better. So to recap, the goal of what we're doing, what your healthcare practitioner should be doing, and what you as an individual and you as your family and support structure should be doing, is trying to take that pain that's taking over your life and restricting your life down to that small little bit of things you can do, and fade that pain into the background of your life so that although it's still there, substantially you're able to live your life, do what you want to do, and get on with things. That is the goal of why you're here. Any educational material is provided for educational purposes only. The CNY Spine Group content contained in reference does not constitute medical advice, diagnosis, or treatment. Please contact your own healthcare practitioner before embarking on a course of diagnosis or treatment. And yes, we really have to say this. We are now going to do a shameless plug for our other media. Why don't you check out cnysspinegroup.com, which you can find on your local interwebs. Particularly important stuff if you're going to be a patient of ours. We are also on Facebook. Got lots of tips from our patients, particularly if you're going to have the operation. You want to see some comments from somebody who've had it, give you some tips about how to do it, what to do. We also, as you know, have a YouTube channel that we're always adding new stuff to. Lots and lots of different topics, anterior cervical discectomies, what's arthritis, stuff like that. And most recently, we have taken to tweeting on Twitter, so you can get my 140 character micro rants. And we look forward to seeing you in any or all of those places. Thank you.